Hello, welcome to Anatomy DAHAR series. Today's topic is the clavicle, the diagram-based upper limb lecture. It includes practice questions and practical quiz at the end. Text slides are from slide 2 to slide 26. Questions and quiz are from slide 27 to slide 30. Color code of the text. The basic anatomy must know in light yellow color. Clinical highlights good to know in light red color. Fine points for the advanced readers in bold print, light blue in color. Illustrated, prepared and presented by Dr. Abdul Hamid, Abdul Rashid. The clavicle. We have two diagrams here, diagram A and diagram B. Diagram A is anterior view of the right shoulder, right arm and right half of the chest. Diagram B is the skeleton of the structures in diagram A. This is sternum, clavicle, scapula and humerus, which is the arm bone. Clavicle. The word clavicle comes from Latin word clavis, means the key. It is a long, slender bone curved like a letter F. If you see in diagram A, the clavicle is subcutaneous. What does that mean? It is deep or under the skin. And subplatysma, that is deep to the very thin sheet of platysma muscles. That means clavicle is very superficially placed, just deep to the skin and just deep to the very thin layer of platysma muscle. It is horizontally placed across the root of the neck. It can be easily palpable throughout its entire length because it is very superficial. The clavicle articulates sternum on its medial side and with the acromial process of the scapula on its lateral side. Clavicle with scapula form pectoral girdle. Upper end of humerus articulates with the scapula and formed shoulder joint. The clavicle is also known as collar bone. Parts of the clavicle. Look at the diagram first. This is the upper part of the thoracic cage. This is sternum in front. This is the first rib. The first rib is connected to the sternum through the cartilage. Ribs are called costa. One rib, costa, more than one costae. The first rib is connected to the sternum through the cartilage. This part is called costal cartilage of the first rib. These are two clavicles, right clavicle and left clavicle. Behind the clavicle, we have scapula, right and left. Each scapula has a process called acromial process. This is acromial process. This is acromial process of the scapula. Now let's talk about the clavicle. Clavicle, as it is a long bone, it has two ends. Since it is located or positioned horizontally, so its ends are medial end and lateral end. This is medial ends and lateral ends of the clavicle. Between the two ends, we have body or shaft of the clavicle. The medial ends are thick and rounded, thick and rounded. The medial surface of the medial end articulates with the sternum, so that medial ends of the clavicle is also known as sternal end. This is inferior surface of the medial end. The inferior surface of the medial end articulates with the costal cartilage of the first rib below. The lateral end of the clavicles are flat and articulates with the acromial process of the scapula. Because of that, lateral end of the clavicle is also known as acromial end. Body or shaft. This is the diagram of the clavicle, right clavicle. We are looking from above, that is superior view. So we are looking the upper surface of the clavicle. This is front, anterior. This is behind, posterior. This is medial side. So this end is medial end of the clavicle. This end is lateral end of the clavicle. Between the two ends is body or shaft. The body or shaft of the clavicle has two parts, medial 2/3 and lateral 1/3. Medial 2/3 is convex in front, anterior, and cylindrical in cross-section. Lateral 1/3 is concave in front and flattened above and below. Surfaces of the clavicle. The medial 2/3, because it is cylindrical, it consists of four surfaces: anterior surface, posterior surface, superior surface, and inferior surface. Lateral 1/3, because it is flattened, it consists of two surfaces only, superior and inferior. Superior surface of the clavicle is smooth. Inferior surface of the clavicle. We are looking the clavicle from below. So showing the lower surface, inferior surface. This is medial side. So this is the medial end of the clavicle. This is lateral side. This is the lateral end of the clavicle. This is behind, posterior. Then this will be the posterior border of the clavicle. Medial end of the inferior surface of the clavicle is rough because it is attached to the costal cartilage of the first rib we have already mentioned earlier. The inferior surface of the lateral 1/3 consists of two rough areas. The first rough area, number 1, is called rough tubercle, known as conoid tubercle. In Greek, conoid means cone-shaped. The second rough area is rough ridge, called trapezoid ridge. The conoid tubercle is below the posterior border of the clavicle at the junction of the lateral 1/3 and medial 2/3 of the clavicle. The trapezoid ridge, which extends diagonally, laterally, and forward across the inferior surface of the lateral 1/3 of the clavicle from the conoid tubercle. This is the conoid tubercle. This is the trapezoid ridge. This is a diagram of right clavicle inferior surface. We are showing from below. This is medial end. This is lateral end. This is posterior border. A shallow groove is present at the middle third of the inferior surface of the clavicle called subclavian groove. Sub means beneath, clavian means clavicle. That means the groove beneath the clavicle. The subclavian groove is bounded by two lips. This is the subclavian groove bounded by two lips. Subclavian muscle is attached to the subclavian groove. See later. Clavipectoral fasciae are attached to the lips of the groove. See in pectoral region DAHAR series. A laterally directed foramen is present at the lateral part of the subclavian groove. It is the nutrient foramen for the blood vessels which supply the clavicle. This is the nutrient foramen. Muscles attached to the clavicle. 5 muscles are attached to the clavicle. They are pectoralis major, deltoid, trapezius, subclavius, and sternocleidomastoid muscles. So this topic is attachment of the 5 muscles to the clavicle. The first muscle is pectoralis major muscles. Pectoral major muscle have 2 parts. One part is attached to the clavicle, we call clavicular part. Another part is attached to the sternum and the ribs, called sternocostal part. Our topic is the part of the muscles which is attached to the clavicle only. So that part is called clavicular part of the pectoralis major muscle. It is attached to the anterior surface of the medial half of the clavicle. If you see in this diagram, this is anterior, this is anterior surface, that is anterior surface of medial half of the clavicle is attached by clavicular part of the pectoralis major muscle. So this is here. Second muscles attached to the clavicle is the deltoid muscle. Look at the diagram here. This is the diagram of the deltoid muscles, and this is right pectoral girdle, this is clavicle, this is scapula. This is lateral 1/3 of the clavicle. This is anterior margin of the clavicle. This is posterior margins of the clavicle. The deltoid muscles is attached to the superior surface and anterior margins of the lateral 1/3 of the clavicle. The third muscles attached to the clavicle is trapezius. This is trapezius. It is attached to the posterior margins of lateral 1/3 of the clavicle. Fourth muscles attached to the clavicle is subclavius muscle. Sub means below or beneath. Clavius means clavicle. So let's see this diagram. This is inferior surface of the clavicle. This is middle third of the inferior surface of the clavicle. If you look here from anterior view, this is clavicle. This is subclavius muscle, which is below the clavicle, inferior to the clavicle. So subclavius muscles is attached to the inferior surface of the middle third of the clavicle. Middle third of the clavicle. The fifth muscles attached to the clavicle is sternocleidomastoid muscles. Let's see the diagram here. Two diagrams we have. Here is the sternocleidomastoid muscles. The lower part of the sternocleidomastoid muscle is split into two. One will attach to the sternum. Another one will be attached to the upper surface of the medial part of the clavicle. If you see in this diagram, this is the superior surface, upper surface of the clavicle. This is medial end, this is lateral end. This clavicular part of the sternocleidomastoid muscle will be attached to the superior surface of the medial part of the clavicle. These muscles are not chief movers of the clavicle. The clavicle moves when the scapula moves. Ligaments of the clavicle. That means we are going to mention about the ligaments which are attached to the clavicle. So it is easier to remember the attachment based on their names. The main ligaments attached to the clavicle are number 1, costoclavicular and coracoclavicular ligaments. The first one is costoclavicular ligament. As the name says, you can see costoclavicular ligament means costo is the ribs, clavicular is the clavicle. That means between the rib and the clavicle, between the costal cartilage of the first rib and medial part of the clavicle inferior surface. So that ligament is between the upper surface of the first costal cartilage and adjacent inferior surface of the medial end of the clavicle. That is costoclavicular ligament. The second ligament attached to the clavicle is coracoclavicular ligament. By looking at the name, you can see this will be attached between the coracoid process of the scapula and the clavicle. This ligament consists of two parts, conoid part and trapezoid part of the ligament. The conoid part is medial. You can see here, this is the conoid part and this is the trapezoid part of the ligament. Conoid part is on the medial side. It's a cone shape. You can see here, the base is attached to the conoid tubercle of the inferior surface of the clavicle. This is the one, conoid tubercle of the inferior surface of the clavicle. We have already mentioned earlier, it is below the posterior border of the clavicle at the junction between lateral 1/3 and medial 2/3. So here it is attached, the base of the conoid part. The apex of the conoid part of the ligament is attached below to the coracoid process. The second part of this ligament is trapezoid part, which is lateral to the conoid part, and it is trapezium in shape. Look at here, trapezium in shape. Superiorly, it is attached along the trapezoid ridge on the inferior surface of the clavicle. Here is the trapezoid ridge in the inferior surface of the lateral 1/3 of the clavicle. We have already stated earlier. Below here, below this trapezoid part is attached to the upper surface, superior surface of the coracoid process, extending laterally. In addition to the above two ligaments, the medial end of the clavicle is attached by number 3, anterior, and number 4, posterior sternoclavicular ligament. As you see the name, you see sternoclavicular ligaments means it is attached between the sternum and attached to the medial end of the clavicle. Anterior and posterior sternoclavicular ligaments. Number 5 is interclavicular ligaments. That means the ligaments between the two medial end of the clavicle. Attached to two medial ends of the clavicle, this is interclavicular ligament number 5. The lateral end of the clavicle is attached to the acromial process of the scapula, so that will be acromioclavicular ligament. We will see in the next slide. The sixth ligament attached to the clavicle is acromioclavicular ligament. This ligament, as it is named, is attached to the acromial process of the scapula on one side and to the lateral end of the clavicle on another side. So this ligament is attached across the acromioclavicular joint and called acromioclavicular ligament. The force from the upper limb is transmitted to the axial skeleton mainly through these ligaments. Ossifications of the clavicle. Look at the diagram. This is medial end, also called sternal end. This is lateral end, also called acromial end. This is medial 2/3 of the clavicle. This is lateral 1/3 of the clavicle. This part is the junction between these two. Although the clavicle is a long bone, it is developed from the membrane by intramembranous ossification. At the junction between the medial 2/3 and lateral 1/3, two primary ossification centers appear, quite close to each other at about 5th week of intrauterine life. They rapidly fuse and extend laterally and medially. The epiphysis, that is a secondary ossification center, appears in sternal, that is medial end, at 18 to 20 years of life, and unites with the shaft at 25 years. Therefore, the last of all epiphysis of the body is here. So this bone clavicle is first to appear, formed in 5th week, and last to stop growing is at the age of 25. Why the clavicle, a long bone, needs to develop by the intramembranous ossification? The intramembranous ossification is the faster process than the interchondral ossification. As stated above, clavicles are needed earlier to protect the crushing injury during labor and thus developed through the faster process of the intramembranous ossification before the birth of the baby. Blood supply of the clavicle. Look at the diagram. This is the inferior surface of the clavicle. This is medial or sternal end. This is lateral or acromial end. So if you see here, on the inferior surface of the clavicle, there's a little foramen is there, that is nutrient foramen. The nutrient artery of the clavicle is the clavicular branch of the thoracoacromial artery coming from the axillary artery. It enters through the nutrient foramen on the inferior surface of the clavicle and directed towards the lateral end. Which is the growing end of the clavicle? Growing end of the clavicle is based on the directions of the nutrient artery. growing end is opposite to the directions of the nutrient artery. That is, the medial end of the clavicle is the growing end. This is the growing end because artery is directed towards this side. So medial end, that is sternal end of the clavicle, is the growing end. Fine points. What are the functions of the clavicle? The clavicle acts as a strut, holding the scapula, and therefore the upper limb is lateral, backwards, and slightly upwards, allowing freedom of movement. It prevents drooping of the shoulder. The clavicle provides attachments of muscles and ligaments in the suprascapular region and assists maintaining the stability of the shoulder joint. It also assists the movement of the arm above the shoulder. Part of the incoming force from the upper limb will pass along it and the ligaments attached to it to the axial skeleton. Why the clavicle is the first bone to be formed? The clavicle serves as strut. During labor, they prevent the lateral compression and protect the thoracic vital organs such as heart and lungs from crushing injury. Therefore, clavicle have to be formed before birth. Fine points. Gender and site identification. Identifying the gender and site, that is right or left belonged, in the paired bones are important in forensic medicine. The clavicle is longer and its curvatures are more pronounced in the male, generally more rough due to the attachments of the stronger muscles and ligaments. To identify the site it belongs to, we must see three axes in any paired bones: transverse axis, vertical axis, and anteroposterior axis. In each axis, identifying just one end or one side is good enough. In the clavicle, transverse axis, thick and round end is on the medial end. So this end should be on the medial side. Vertical axis, rough surface at both ends is inferior. So rough surfaces must be below. Anteroposterior axis, convex medial 2/3 is anterior. So convex medial 2/3 should be directed in front. Fine points. Peculiar features of the clavicle. Usually, the clavicle is the first bone to be taught in anatomy. It is the only long bones in the body which lies horizontally in anatomical position. It is the only long bone ossified by membranous ossification. However, its secondary center is the medial, that is the sternal end, and ossified by endochondral ossification. It is the first bone to ossify in the body at 5 to 6 weeks of intrauterine life. It consists of two primary ossification centers. Other long bones consist of only one primary ossification center. It is the last bone to stop growing, fused with the shaft at around 25 years of age. Generally, it is said that the clavicle is the long bone without a medullary cavity. Cutaneous nerve or nerves often pass through the clavicle, as the clavicle develops from the membrane. Lastly, it is the commonly fractured bone in the body. Fine points. Posterior relation of medial 2/3 of the clavicle. That is, structures located behind the medial 2/3 of the clavicle. Behind the medial 2/3 or medial end are three veins: internal jugular vein, that is terminal part, subclavian vein, terminal part, and brachiocephalic vein, the beginning part. 6 divisions of the brachial plexus, 3 anterior and 3 posterior, come from the upper, middle, and the lower trunks of the brachial plexus. The third part of the subclavian vessels and suprascapular vessels along the upper part of the posterior surface of the clavicle. These are the structures related posterior to the medial 2/3 of the clavicle. Clinical highlights. Mid-clavicular line. Look at the diagram. This is the thoracic cage. This is the clavicle. Mid-clavicular line is an imaginary vertical descending line through the midpoint of the clavicle. That is the vertical line passing through the middle of the clavicle. Inferiorly, it passes through the mid-inguinal point. That is the point at the middle of the inguinal region. Some important clinical landmarks are along it or close to this line. Clinical highlights. Fracture of the clavicle. Fracture of the clavicle is common when due to indirect violence on the outstretched hand. The break is between the attachment of the costoclavicular and coracoclavicular ligaments, usually at the junction of medial 2/3 and lateral 1/3. It may occur at other parts, middle third in 80 to 85%, medial third in about 5%, and lateral third in 10 to 15%. Why the fractures of the clavicle are common at this site? At this site, the clavicle is weak because, number 1, 2 curvatures of the clavicle facing the opposite direction meet. Number 2, each has a different in cross-sectional shape. Number 3, the axis of the direction of the lateral force suddenly change. Number 4, there is devoid of muscles covering the clavicle to protect the injury. Number 5, nutrient foramen pierce through. And number 6, supraclavicular nerve may pierce through. Prognosis. Non-union is in about 50% of the cases. What may happen to the fractured clavicle? Look at the diagram here first. This is the clavicle. This is the fracture site. This is coracoclavicular ligament. This is sternocleidomastoid muscles. This is trapezius muscle. When the clavicle is fractured medial to the attachments of the coracoclavicular ligament, that is fracture medial to the attachments of the coracoclavicular ligaments, its 2 fragments are displaced in different directions corresponding to the muscle pull. The medial segment of the clavicle is displaced upwards, look here, upwards, due to the pull by the sternocleidomastoid muscle. The trapezius, which is attached to the lateral 1/3, trapezius, if you see very carefully, is unable to support the weight of the arm. The lateral fragment is drawn downwards by gravity and also drawn medially by the shoulder adductors. They are pectoralis major and teres major muscles. This leads to the overriding of the two segments and the shortening of the clavicle. Clinical highlights. In fracture of the clavicle, there is danger of getting penetrating injuries to the structures closely related to the clavicle. Such structures are subclavian vessels, divisions of the brachial plexus, veins, and pleura, which are likely to be injured. Cleidocranial dysostosis. It is the autosomal recessive disorder in which the clavicle may be absent or show defective ossification along with defects in cranial bones that also ossify in the membrane. A person without clavicles can bring the two shoulders too close together in front of the chest. Bilateral dislocation of sternoclavicular joints causes instability of the clavicle and called floating clavicles. Now we have reached to the end of the text part of the clavicle. Slides 27 to 30 are practice questions and practical quiz. Would you like to try? Welcome. The end, illustrated, prepared and presented by Dr. Abdul Hamid Abdul Rashid. Now is the good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available to you. Anatomy DAHAR series also provide other videos related to the present topic. Thank you for watching.